Hello guys, I hope you are, and today we're going through levothyroxine. So a very crucial point of levothyroxine is the fact that when you have calcium carbonate or calcium supplements, you need to separate administration for 4 hours. So if you take calcium carbonate with levothyroxine, this will affect the absorption of levothyroxine, and I want you guys to keep that in mind. So do not prescribe levothyroxine if there are suspected hereditary problems of galactose intolerance, and if there's glucose galactose malabsorption. This is just a sort of niche point. I don't really think this will come up. But an important point is do not prescribe levothyroxine if there is suspected thyrotoxicosis. A very crucial point. Prescribe levothyroxine with caution in people with CVD disorders, such as hypertension, angina, heart failure, MI, and a baseline ECG may help distinguish underlying MI from changes due to hyperthyroidism. So an interesting point about a lot of antibiotics is that tetracycline can cause QT interval prolongation, right? And a lot of these antibiotics and other medications, they are cautioned in myasthenia gravis. So the connection or link I want you guys to understand is thyroid problems are linked to cardiovascular issues, and that's why it says that you need to have a baseline ECG to help distinguish underlying myocardial ischemia from changes due to hyperthyroidism. So tetracyclines, they are cautioned in myasthenia gravis. So are other medications. So this one here, prescribe levothyroxine with caution. I'm pretty sure levothyroxine you have to prescribe with caution in myasthenia gravis as well. I need to confirm that before saying that. But yeah, so who are breastfeeding or pregnant, levothyroxine therapy should be supervised by an endocrinology specialist, and advise the person to take LT. So this is about thyroxine tests. So advise the person to take LT4 medication on an empty stomach in the morning before other food or medication. These are some ADRs. So LT4 here represents levothyroxine, which I've never ever seen. Okay, so advise the person to take levothyroxine medication on an empty stomach in the morning before other food or medication. I've actually never seen levothyroxine represented as LT4. That's interesting. So ADRs of levothyroxine is GI problems, CVD issues, as we've said. So an important link for the Gphc exam is if you have a patient with hypothyroidism, the changes due to that can lead to some CVD issues. So if a medication will cause hypothyroidism or is cautioned in that, there is a high chance you may need to do baseline ECG. You know, a bit like amiodarone. Amiodarone needs a baseline ECG if we look at amiodarone monitoring. Now, you have metabolic issues such as weight loss, and that is a key point because with hypothyroidism signs, you can get palpitations and weight loss. And yeah, these are very important points to go through. So let's look at drug interactions. Levothyroxine may enhance the effect of anticoagulants such as coumarins, for example warfarin. So warfarin is a coumarin. A coumarin is just a drug family. It is a naturally occurring molecule or substance in reality, but warfarins are part of that sort of drug group. It's called coumarins. And obviously we need to monitor INR. That's the biggest distinguishment with warfarin and DOACs. Warfarin require INR monitorings. So if you have a patient that's really impaired, you may give warfarin, but you need to monitor the INR more frequently. With antidepressants, there may be a concomitant interaction when you give both. So antidepressant response to tricyclic antidepressants can be accelerated. Concomitant administration may precipitate cardiac arrhythmias. So this is very important, and it could be because of its hypothyroidism effect, so it will affect the heart. Beta blockers, so beta blockers may decrease peripheral conversion of levothyroxine to triiodothyronine. Levothyroxine accelerates metabolism of propranolol. This is crucial. And last but not least, let's look at digoxin. So cardiac glycosides, which are digoxin. People with hypothyroidism may be initially sensitive to digitalis, which is... Digitalis, I assume, is a chemical in digoxin. However, the antidote for digoxin is Digifab. So when someone is toxic, when someone has digoxin toxicity, they usually refer to it as digitalis toxicity. I'm not sure what they mean by digitalis here. I'm going to assume it's a molecule in digoxin, but may need a gradually increasing dose of cardiac oxides as treatment for levothyroxine progresses. And let me keep the video short, and thank you